Sleep is so important for our health and our well-being. But 10% of Americans have insomnia, while 30% of Americans have difficulty either falling asleep or staying asleep. Well, here to talk about what's new in the area of sleep and sleeplessness is our pharmacist, Dr. Michael White from the UConn School of Pharmacy. Good to see you again,
Hi.
sir. Hi. All right, start by telling us why sleeplessness is such a problem.
Yeah, so when you're not sleeping properly, it can impair your concentration during the day, increase risk of different accidents like motor vehicle accidents, accidents in the home. It also, when you're normally sleeping, your heart rate, your blood pressure goes down, helps to create a nice circadian rhythm throughout the day. When you lose that through sleeplessness, it increases your risk of heart disease, it increases your risk of stroke. So there's a lot of important reasons why, getting enough sleep is very important.
Yeah. Now, what about sleeping pills for people who are having problems with it? What are the benefits? What are the risks?
Yeah, so over-the-counter sleeping pills for some people are effective. One of the things they found in a recent survey of 4,000 people was that 20% of people had used sleeping pills, and 20% of those used it every day for a year. And therein lies some of the problem. Over-the-counter sleeping pills are indicated for up to 14 days worth of therapy, and they're pretty safe over the course of those 14 days. Some people, when they're taking it, may have some increased confusion, a little less coordination after they take the product. So again, maybe some increased risk of falls, but by and large, very safe products for short-term use. Some of the products that contain things like Benadryl to help you sleep also contain acetaminophen, which is the active ingredient in Tylenol, or ibuprofen. Those products you have to worry about, how much you're taking and whether you're taking it with other acetaminophen, because there's a limit to how much Tylenol that you can take for your liver, so you need to keep that into consideration. But for short-term use, as long as you're not overdoing it, it's relatively safe. Prescription drugs are more potent. Some of them can last for a longer period of time depending on the preparation you have, but the chance for doing sleepwalking, like serious sleepwalking, even when you're an adult, and then doing something that you didn't want to do, are increased. Daytime sleeplessness is a problem. You go through your day and you still have some residual effects, especially when you're trying to drive in the morning. That could be problematic for certain people. And then some of the mental confusion that can come along with using those products. But again, for short-term use for some people, if the over-the-counter products aren't working, it's something that you could do. Melatonin is your last option. In a meta-analysis of a bunch of different studies, they found that melatonin seems to be effective, but only very mildly effective. On average, people getting about 10 to 15 minutes extra a night.
That's it, huh?
That's it. But keep in mind, when you look at an average, there's always an average and a standard deviation. So that means that some people were getting very little, if nothing, and then other people were doing better, 45 minutes up to an hour. Now, one of the limitations of all of those products, since it's a natural product, is that we reported before that sometimes natural products may not contain what is on the label inside the bottle, or the concentrations may not be. So what does melatonin itself do? It's hard to tease out from these studies because they didn't verify or validate what was in the bottle is what was on the label.
Okay, so here's hoping sleeping pills will help for 14 days, but what about chronic problem? What about insomnia? What do you do after those 14 days?
That's right. So when it's day one, and so some people wait till day 14, that's problematic. On day one, when you start to have those problems, you need to go back to the basics of good sleep hygiene. There's lots of things that you can do. One of the most important is no electronics for 1 hour before bed. A lot of smartphones and other products have blue blockers, or what they call sleep modes, where when it gets closer to bed, when you put on those special modes on your phone, it takes away some of the blue rays and gives you more shades of reds and yellows that are less likely to negatively impact your sleep. So staring right at a screen decreases the levels of your natural melatonin, makes it harder for you to fall asleep. Some people are ready to go to sleep, but it's not the time that they have set in their mind that they want to go to sleep. So they try to fight through this tiredness that they have, and then when it's time to go to sleep, the body has released cortisol, and this cortisol gives them a jolt, and now it makes it hard for them to be able to go to sleep. checking an email 2 minutes before you go to bed, and then your boss tells you something that irritates you. Not good. You can't do anything about it anyway. It's better not even to know and just take care of it during its normal time.
See, there's a number of benefits to stay off the screens for an hour beforehand. All right, thank you so much. Good to see you again, Doctor. And as always, if you have a question that you would like Dr. White to answer or a topic you'd like to hear more about, you can ask the pharmacist by sending us an email to morningnews@fox61.com.